इंटरेस्टिंग टॉपिक के साथ आए हैं। जो क्वेश्चंस पेरेंट्स वगैरह से आप नहीं पूछ सकते, मैं तो नहीं पूछ पाती थी। एंड स्कूल में भी कोई बहुत अच्छे से एड्रेस तो करता नहीं है। स्वामी ने एक इंस्टाग्राम लाइव सेशन भी किया था इस पे ऑन टीनेज सेक्सुअल हेल्थ, एंड आई कैन रिलेट टू इट, यू गाइस कैन रिलेट टू इट।
Even we can relate to it. Like
Yeah, teenage, totally relate. Sure, my teenage companions.
ये रिश्ता क्या कहलाता है?
this video is about girls, so I'll be out of the video, but we might do something about men also.
Okay.
So let's get into the video.
बस यही बोलना होता है।
ये बात सच है।
So hi Dr. Kirti.
Hi.
तो Dr. Kirti is a gynecologist. उनकी like educational background बहुत ज़्यादा interesting है. So why don't you only tell us कि आपका educational background क्या है पूरा?
मैं बॉम्बे में born and brought up हूँ। मैं वहीं पर मैंने मेरा MBBS किया, जो साइन हॉस्पिटल, there is this big hospital नाम से किया।
हाँ, it's very famous also.
तो MD मैंने दिल्ली से की, उसके
कहाँ पे?
बाद
दिल्ली से?
लेडी हार्डिंग से,
ओह,
और फिर सब
goals guys, goals.
उसके बाद मैं US चली गई थी 2 साल के लिए।
Okay.
पर वहाँ मैंने कोई मेडिसिन नहीं की, वहाँ पे मैं हिस्ट्री और फिलोसफी कर रही थी।
So what would you say to parents who just force their kids to study science because science has a career and arts does not?
आई थिंक लेट एवरी किड फाइंड देयर ओन वे, बिकॉज हर एक का अपना रास्ता होता है, हर एक का अपना तरीका होता है। तो व्हाट आई वुड सजेस्ट इज, मतलब अगर मुझे बहुत देर आके मैंने सोचा कि नहीं मुझे राइटिंग में भी इंटरेस्ट है, एंड अलॉन्ग विथ माई मेडिसिन आई एम स्टिल कॉन्सेंट्रेटिंग एंड ट्राइंग टू डू माई राइटिंग वट एवर आई कैन। तो आई
आपको राइटिंग और फिलोसफी और हिस्ट्री वगैरह
आई थिंक हर एक को होना चाहिए। आई मीन दीज आर थिंग्स विच डिफाइन आवर वर्ल्ड। और मुझे मेडिसिन प्रैक्टिस में ये हेल्प करता है, मुझे लोगों की बात समझने में हेल्प करता है। आई थिंक इट एड्स मोर इवन टू माई प्रैक्टिस।
So the first question कि actually में like what all developments occur when we enter puberty, हमारी body में बहुत सारे changes आते हैं, and not just physically, मतलब emotionally, mentally also we're like you know maturing.
जो ज़्यादातर गर्ल्स आते हैं या मदर्स आते हैं, वो ऐसी चीज़ें लेकर आते हैं विच आर एक्चुअली परफेक्टली नॉर्मल। मदर विल कम विद हर डॉटर एट 10 years of age and say इसके तो ब्रेस्ट डेवलप हो रहे हैं, एंड आई से नो दैट इज एब्सोल्युटली नॉर्मल। आई मीन अराउंड एनी टाइम आफ्टर 8, depending upon the the genetics of the girl, depending upon the weight of the girl, about the physical stature, तुम्हारा ये breast development can start. Then you have hair growth happening in all kinds of places which happens after that. So there's no need to worry about these changes, because any time between 8 to 12, 13 these changes can start. After that you get your periods, which can again happen any time between 11 to 15 years of age, and which will then be followed by a growth spurt. उसके बाद तुम देखोगे कि तुम कुछ महीनों में इंचेस ग्रो हो रहे हो। उसके साथ फिर बहुत सारे इमोशनल चेंजेस आते हैं। तुम जिस भी गेम में इंटरेस्टेड हो वो गेम्स बदल जाते हैं। जो मूवीज़ तुम पहले देखते थे वर्सेस बाद में जो मूवीज़ तुम्हें पसंद आती हैं वो चेंज हो जाते हैं।
Mom always used to be like कि कब ये बड़ी होगी, कब ये अच्छा म्यूजिक सुनना शुरू करेगी, कब ये she'll get out of that One Direction phase जो छोटे बच्चे सुनते हैं। and ये वो वेट करते थे इन चीज़ों का।
ये अब भी वेट कर रही
अभी भी वेट कर रही है। मेरे को हिट हुई है।
We noticed that Vidhi's height had suddenly started to increase. She was shorter than me until last year, and then now she's taller than me.
I mean that happens. So believe me, I was the shortest in my class for a really long time. So I appreciate that a growth spurt happens, and it is a good thing. So wait for it. No need to hurry. Don't be worried कि तुम्हारे friends आगे हैं तुमसे या उनके periods पहले आ गए या
I had a friend, मतलब my best friend in class, she had her periods in 5th only, and we had our first sexual health session in 5th class, and we like पता नहीं क्या बता रहे हैं, हमें तो कुछ समझ में नहीं आ रहा है ना। like वो first time introduce किया था कि what are periods and all, क्योंकि मेरे को तो कभी घर में भी किसी ने कुछ नहीं बताया था, तो मुझे ठीक से समझ नहीं आया था। बट मेरी बेस्ट फ्रेंड ने दीदी देखो पता है मेरे को होते हैं या फिर खून निकलता है, दर्द होता होगा बहुत ज्यादा। नहीं कुछ नहीं होता ऐसा करके, बट उसको 5th में ही हो गया था। एंड लाइक और क्लास में हमारे पूरी क्लास में किसी को भी नहीं था, तो वो कहती थी कि आई डिडंट यूज्ड टू टेल एनीवन बिकॉज आई फेल्ट weirded out by the fact that I was the first one जिसको मतलब हुआ है।
so ये जो कॉम्प्लिकेशंस आते हैं उसके साथ कि मतलब पहले हो रहा है, लेट हो रहा है, ऐसे नहीं हो रहा है, वो हो रहा है, you just wait for your turn guys, it will come. And only be worried if you don't get your periods by the age of 15, then you go see a gynecologist.
So guys, आजकल बहुत ज़्यादा hype है about virginity and all. सारे जो आप American TV shows वगैरह देखोगे, even Indian TV shows देखोगे, उसमें लाइक बहुत ग्लोरीफाई करके बोला जाता है हैविंग सेक्स एंड ये सब लाइक, और ये ऐसे टॉपिक्स हैं जो हम अपने पेरेंट्स वगैरह के साथ डिस्कस ही नहीं कर सकते, मतलब यू कांट आस्क देम कि क्या व्हाट इज द हाइप अबाउट, व्हाई इज ऑल सॉन्ग्स, ऑल टीवी शोज, ऑल मूवीज अबाउट दिस। तो मुझे ये जानना है कि व्हाट डू यू थिंक मेडिकली इज द राइट एज टू हैव सेक्सुअल इंटरकोर्स?
Okay, so that's a very loaded question, है ना? There are no easy answers for this question. One is first तुम्हें law of the land पता होना चाहिए, ठीक है? So there is this law in this land which is the POCSO Act, right? This is basically to protect children from sexual abuse. पर उस एक्ट के तहत क्या है कि up to 18 and mostly वो 16 तक ज़्यादा strict है, 16 के बाद 18 तक उतना नहीं, that sexual intercourse it does not recognize the difference between consensual versus non-consensual. वो उसके नीचे सबको बच्चे के हिसाब से देखते हैं, तो उसके बारे में बस आपको थोड़ी सी अवेयरनेस होनी चाहिए. आई थिंक दैट इज़ इम्पॉर्टेंट. द सेकेंड थिंग रिगार्डिंग व्हाट इज़ अ गुड टाइम, हर एक का सेक्शुअल डेवलपमेंट हैपन्स differently. Once you've had your growth spurt, your body has reached its final, let's say, stage. तो तब you're more or less ready. It's safer for you to have sexual intercourse than before that. क्योंकि अगर तुम पहले कर रहे हो तो तुम्हें इंजरीज हो सकते हैं, तुम्हें इन्फेक्शन के ज़्यादा चांसेस हैं, तुम्हारा नेगेटिव एक्सपीरियंस होने के चांसेस ज़्यादा हैं. जो तुम्हें सिर्फ फिजिकली अफेक्ट नहीं करेगा, वो तुम्हें इमोशनली अफेक्ट कर सकता है. वो तुम्हें कुछ लड़कियों को जैसे अवर्जन हो जाता है उसके बाद फॉर अ लॉन्ग टाइम. एवर्जन मतलब फिर उनका क्योंकि फर्स्ट इनिशियल एक्सपीरियंस ख़राब रहा है, उसके बाद दे डोंट सी इट एज अ गुड एक्सपीरियंस. उसके साथ डिप्रेशन ज़्यादा एसोसिएटेड होता है. लेस देन 17 में कुछ स्टडीज़ हैं जो बताते हैं कि अगर इफ़ यू नॉट हैड अ गुड एक्सपीरियंस, जिसका चांस इज़ मोर इफ़ योर डेवलपमेंट इज़ नॉट कम्प्लीट, तो देन यू कैन हैव अ नेगेटिव एक्सपीरियंस एसोसिएटेड विद इट, और फिर तुम आगे जाके वो आपका सेक्शुअल हेल्थ मेंटली इमोशनली भी अफेक्ट करेगा. सो इसीलिए वी सजेस्ट दैट यू टेक योर टाइम विथ इट. No need to glorify virginity.
Yeah, that's true.
But at the same time, there is no need to try and push yourself with it for reasons just peer pressure.
Yeah,
You
so
know, all those
very
things.
honestly, like there were people in my school and even in my friends group who used to be like कि उनको चिढ़ाया जाता था कि oh he's a virgin, oh he's a... even in my age, like, I'm like what, why are you like मतलब why are you making fun of people for this? When people my age do it, they come the next day like oh we did this. like इतना glorify कर देते हैं कि जिसने नहीं किया उसको इतना peer pressure feel होता है कि oh my god ऐसी क्या awesome चीज़ है जो हमने नहीं करी.
And we've all been through this, isn't it? So there is a lot of like this talk and peer pressure around it. So that should not be the reason that you go for it.
So the next part is about contraceptives. क्या options available हैं? अभी बहुत teenagers are like sexually active and they don't know about these contraceptions, and the after effects can be really harmful. So can you please tell us about that?
The most commonly used one, especially for teenagers, what we would also recommend would be the barrier contraceptives, मतलब condoms, which you can get anywhere, right?
And
Those
there are the female condoms also, na?
Yes, the female condoms are a little more cumbersome to use.
Okay.
So that will require some practice. But you can try, and it is not as easily available as your normal regular condoms are. So so there are two reasons why condoms are useful. One is they avoid pregnancy, obviously, जो तुम्हारा basic goal है, but also STIs, exactly. So sexually transmitted जो भी infections होते हैं, which have become very less common, but they can have long-term effects. और ऐसे भी uncommon नहीं है, like white discharge and this, all of this, half of the problems with all this discharge after intercourse will be because of your sexually transmitted infections. If you're in a regular relationship, or if you have PCOD and things like that, we also recommend some oral contraceptives, which are your oral contraceptive pills. Now, oral contraceptive pills are available over the counter, but what we recommend is that you always go to a gynecologist and get an initial prescription at least. Also, if you're taking OC pills, you have to maintain your hydration very well.
And are there any side effects of these?
There can be if it doesn't suit you very well. Sometimes initially your body takes time to get used to it. So you have some water retention, तो तुम्हें bloating होती है, you feel heavy, there might be some weight fluctuation that you see initially. In some cases we do see headaches बढ़ जाते हैं and things.
And what about the emergency contraceptive pills?
It protects against one intercourse taken within 72 hours. So it can be, the failure rates of IPIL are relatively higher. So it cannot be a regular go-to for contraception. You can use it once in a while, but it cannot be a regular thing. And if you use more than 2 times in a month or something like that, then you can have irregular periods after that. You know, these are hormones, these are medications, these are interfering with your body. So I would recommend that you take this responsibly.
A lot of questions that I got were regarding female masturbation. Is it legal? Is it healthy? Can you just tell us a little bit about it? Is it okay for women to masturbate?
Masturbation, whether for female, male, whatever gender you identify yourself with, is healthy. You know, it's one of the best ways you have of kind of exploring your body. Of, you know, first, before having sexual intercourse, why don't you first understand your own body and, you know, what do you like, what do you not like?
Is it legal?
Yes, absolutely legal.
Okay.
It's legal, it's safe, no pregnancy, no infections.
And is there any particular age that a person has to be to?
Not really. There is nothing to do with age. Whenever you feel ready for it, it's fine.
So the next topic is vaginal health and menstrual hygiene. Dr. Kirti, the most amount of questions we got were vaginal secretion. So there is this white secretion that happens after the periods. What if it's colored? What if it is smelling a lot? Or what if it is so much that it wets their undergarments?
So what you need to know is the difference between what is normal and what is something that you have to be worried about. So even normally, once you start getting your period, some amount of discharge is normal, especially before your periods, especially when it is just thin white in color. See, most discharges will not be dangerous. It will just be like an infection. It will most likely be a yeast infection or a fungal infection. तो उसके लिए, but you need to go to a gynecologist. Don't self-medicate. The second kind of infection is if it is yellowish or greenish, or if it is a lot. The third is if there is any amount of blood tinged or blood apart from your periods, if you're getting it, then you need to go. What it basically means is that if you have irregular periods, if you have skin problems, if you have a lot of hair growth happening in abnormal places, excessive weight gain, you would have these problems. So ये जब एक साथ आते हैं along with hormonal changes which we make out using blood tests or an ultrasound, then it comes under PCOS. Now the main thing that you need to know is that it is becoming very common, that 1 in 10 to 15 girls is going to get it now.
Yeah, I know
almost.
so many of my friends who have it, and it's
Absolutely, and it is not one thing, it is a spectrum.
Yeah.
वो एक चीज़ नहीं है. It's more like you can have maybe just irregular periods, you need not have weight gain or something happening yet, or you can have the full blown disease जहाँ पे acne भी हो रहा है, hirsutism भी हो रहा है, periods भी irregular है, obesity भी हो रही है.
Is there any way to control it?
First thing that we prescribe for any polycystic ovarian disease or syndrome is diet and exercise. Take adequate protein in your diet to do your hard work as far as the exercise is concerned. And exercise not just ki walk kar liya, half an hour, that is not enough. What we prescribe is at least 40 to 45 minutes of exercise 5 times a week, and ideally it has to be some kind of weight bearing exercises. So it doesn't have to be the gym, right? You can just have some weights at home and kind of learn to do the basic exercises. Once you have stronger muscles, you will your body will process the hormones better.
okay.
Right? So exercise and diet, in fact that would be my first prescription. Medicine comes after that. Mild to moderate forms you can control with just diet and exercise, what we call lifestyle modification. And there are a lot of resources online for this. There are some myths going around, like you cannot get pregnant with PCOD.
Yeah.
That is not true, guys.
One of my friends used to say that matlab she had PCOD and she used to be like, my doctor says that I cannot get pregnant only. I used to think ऐसा थोड़ी होता होगा, मतलब logically भी मेरे को लगता था ऐसा तो नहीं हो सकता.
No, so that I mean you can get pregnant. You will need treatment. You might have also heard of cases जहाँ पे IVF करना पड़ गया.
हाँ.
But that's not necessary, and if you control it from now, and that is why it is good to talk about it now, because if you can, as early as possible, if you start controlling it, then the lesser the problems you have. It's like diabetes or blood pressure.
And what about parents who are a little reserved about their kids taking medication?
No, not at all. The medication that we prescribe for this have very minimal side effects. They are just either hormonal pills, or they are some basic medication which doesn't interfere with your body too much, and it is necessary that you take this medication to control. So I would suggest go to a gynecologist, get the medication, Don't worry about the fertility. It might cause problems, but it can be treated and it can be controlled.
I guess that's it.
It was really educational for me once
हाँ,
again.
हाँ.
Thank you so much, Dr. Kirti, for taking the time.
एंड मामा पीछे खड़े होके बस आज इतने खुश है ना कि उनको वीडियो में आना नहीं पड़ रहा, कुछ करना नहीं पड़ रहा.
So if you like this video,
Please like, share, or subscribe to Three's Crowd.
Thank you for saying our channel name right. And we'll see you guys in the next one. Bye. Oh, I remember there used to be like a rumor in our class which said that so there's this boy who used to the rumor when I was in 8th. So there used to rumor this when I was in 8th there was this rumor.
टंग स्लिप हो जाती है हमारी.